So, how are you today, Jay?
I'm good, Karen. How are you?
I'm good, thank you. So, today we
Good.
have Jay Tolman here, who's the Director of Community Outreach for Home Instead. And I just wanted to let you introduce yourself to everyone and what led you
Sure.
to Home Instead and maybe a little bit about your background.
Sure. Well, thanks for having me, Karen, first of all. Um, my background, I worked for about 25 years in the software industry in home health,
Okay.
electronic medical record software. Uh, so I was sort of in and around. Our clients were hospitals and VNAs, and the software was actually for the clinicians documenting in the field. So I learned a lot about home health and home care because those were our clients. So I traveled around the country with different territories, and after 25 years, I sort of got tired of hopping on a plane every week and
Hmm.
flying all over the place. So I was looking for something that was a little more uh, in this area. So my wife, Jody Tolman, had started into the senior care industry about 11, 12 years ago. And, when she came home and we'd be talking, it just sounded like an area that I uh, would really like to get involved with. So my first job was with the memory care community,
Okay.
which was really very enlightening and educational. And so from there, I came to Home Instead. Todd Anderson, who owns our franchise, and I had been talking, and so I came to Home Instead and been here for about 6.5 years now, and
Oh,
just really enjoy it. I think I probably should have been a social worker back in the day,
yep.
because I really enjoy working with the families.
Yeah. Well, it's good that you made it here now, right? So
Yeah,
that's
right.
important.
Yep, I'm here.
Yeah. So which is great. So you found your passion, which is
Yeah,
awesome.
yep,
So tell me, so Homestead's been around since 1994.
right.
So how has it evolved since their beginnings? I know you said six and a
Yeah.
half years, and is that how long the Norwell franchise has been open?
No, it started out actually as a husband and wife out in Omaha, Nebraska,
Hmm.
that actually started Home Instead. And that agency, they saw a need in the community for home care, and it was really more companionship than anything else. So that grew and grew and grew, and then over time, they opened more offices. Then they started franchising, and now there are over 600 homesteads around the U.S. and about 450 internationally.
Oh,
So yeah, there's a homestead anywhere you go. There's a home instead. Each office is independently owned. Todd Anderson is our owner here in Norwell. And what I like about it is that we cover, a certain territory. We're not trying to take over the world here out of our office. So we have 13 towns that we cover, which is we can get anywhere in our territory within about 20 minutes, half hour at the most.
hmm. And how many caregivers do you have currently?
Currently, we have close to 90 caregivers. We could always use probably another 20,
Hmm.
but we're positioned actually pretty well at this point. It's difficult. It's because we're not just hiring anybody. I don't think any home care is looking to hire anybody. So it's not just um, a warm body to send into a family's home. We really spend a lot of time, looking very closely, not only their background and background checks and all of that, but really looking for people who have compassion and empathy and really want to help people.
Hmm. So tell me, the caregivers, are some of them for companionship and then others for ADL? And for people who do not know ADL, it's activities of daily living,
Right,
correct?
right.
So they're for
Yeah,
both.
yeah. Depending, I mean, depending on the applicant, There may be people who don't have any personal care or ADL training.
Hmm.
We are more than happy to train them and get them into the field in that area if they like. Um, but there's a combination of companionship and personal care, and really getting into some very difficult situations where you may need a Hoyer lift and things where there's a lot more care involved. And we have CNAs, home health aides that are all certified, and the makeup really of the caregivers is sort of a pretty wide spectrum. As I mentioned, CNAs and home health aides, but then we have retired nurses, retired LPNs. We have people who took care of a parent or a loved one that wants to give back and
Hmm.
help. Um, so there's a lot of initial training that goes on, prior to going into the field, no matter what their background is. They could be, certified, CNA. They still have to go through our extensive orientation before they start with us.
Okay, so that's good. I think that
Yeah.
would be very important to families. And then,
Yeah.
so do is most of it? I would assume would be scheduled, and then there are times when things may not be scheduled, where someone might need something like last minute.
Yeah. I mean, scheduling is probably the most difficult piece of the puzzle here,
Hmm.
as far as the needs and demands. I think that one of the things that um, really helps us is the more notice that we have, the better.
Hmm.
But we are able to turn on a dime. I mean, somehow we've done a really great job over the years, where we've had situations where we get a call at 11 in the morning and we have a caregiver in the home at 1 p.m.
Yep.
So, uh, but that being said, the more notice we have, the better. And I think for families, it's important to sometimes, if someone is coming out of the hospital or rehab, the more notice a family member has to be able to pursue other sources of support like home
Hmm.
care, the better it's going to be for everybody. Because the important thing too is for us, is to be consistent with the caregivers.
Hmm.
We do a consultation with every client prior to coming on board, and that way we can really find out what the needs are, and also even from a personality standpoint, so we can match personalities with our client and caregivers on both sides.
Okay. So
Yeah.
how long does something like that usually take the consult? And then do you also do a safety assessment, a home safety assessment at the same
Yeah.
time?
Yep. Yeah. It depends. I mean, we may do that at a separate time. I may go visit somebody. I do most of the consults.
Okay.
Um, what we typically will do is, if they're in a rehab, go to the rehab and meet them and talk to the case manager and family, and then do a home safety evaluation, and make recommendations for the family too, and what equipment they might need, and resources for that. I think one of the uh, challenges, I think, for families is navigating all of this.
Hmm.
Um, you know, and what I try to do is network with as many people as possible in the industry, like yourself, so that I have resources at my fingertips to be able to provide families, so that they may call, just seeing if we have availability, what the cost is, what the minimums are, all that kind of stuff. And I try to dig down and really try to find out what's going on, because it may be they don't need us, they need
Hmm.
some other support that I might be able to direct them to.
Oh, so that's good. Now, I just
So,
want to go back for a minute because you mentioned
sure.
rehab. So,
Yep.
do I know a lot of times these things happen because people are in crisis, right?
Yep.
So, is that
Yep.
is that a high percentage of what you see as that you're meeting people in rehab, or?
Yeah, I mean, many times I think people it depends.
Hmm.
Some people learn at the last minute, my mom's going to get out of rehab tomorrow. Um, but did they really just find out about that, or did they talk about it and not act on it?
Right.
But it really doesn't matter. The need is there. So I can respond, and we can respond really pretty quickly on the consult part of it. Getting to go to see a client. The difficult piece, as I mentioned earlier, is really the scheduling and matching up and availability and all of that. So
Hmm.
it usually takes us a couple of days to get going.
Yeah.
But as I say, in a crisis situation, we've been able to respond pretty much same day.
Yeah, that's good. And then what about
Yep.
you mentioned minimum hours. What does
Yep.
that look like?
Yep. So the minimum shift is 4 hours. We used to be less, but the caregivers, don't want to work less than 4 hours, which I
Hmm.
totally get. And then 12 hours a week. So it could be a Monday, Wednesday, Friday, 8 in the morning till noon, as an example. And
Okay.
that sort of plays into scheduling. And also, we feel very strongly about building the relationship with people, with
Hmm.
our clients and caregivers, and having more days, a few days in there, I think helps provide that as well.
Okay. And then do you go into assisted living and independent living as well as just the people's homes?
Yep, yep. It depends on the situation and what the needs are for the folks in assisted living.
Hmm.
There's some cases where hospice is involved, and
Okay.
it's sort of end of life, but they're in assisted living, and they need additional support to fill in. And then some people who just want more companionship and maybe want to get out individually and do something, go down to the beach, go for a walk,
Hmm.
things like that. So assisted living, independent living. I just got a call today from a rehab. A family member wanted us to go in and spend time with the mom who has dementia,
Mm.
and just engage with her a little bit more than what she can do and provide.
Right. Oh, so that's good.
Yeah,
Um, I know. So you just brought up something else about the. Well, I guess let's talk about the. I guess this my question is, what
yeah,
do you think? You talked about navigating, right, for the families, which
yeah,
I can understand. Just being myself, not being, as I like to say, the layperson in the field, right?
right.
Um, in terms of navigating this, what sets Home Instead apart from your competition, and how do
Yeah.
they find? And then how do they really find you? How do they seek you out? And is it usually from a social worker type of thing, or how does the family find these
Um,
services?
yeah, yeah. Well, I think, finding us, I track how people do find us,
Hmm.
when I'm talking to them, how they did hear about us. A lot of it is word of mouth. Home Instead, we have, national um, advertising, TV advertising. We do quite a bit of advertising locally. I think more it's, just I participate in a number of networking groups,
Hmm.
and I think that helps in the knowledge base of being able to help navigate, as I said,
Right.
the industry. But I also think it's community.
Hmm.
Um, I belong to the Alzheimer's Partnership of the South Shore. We do a lot of work in helping. Um, Once a year, have a big event to raise money so that we can provide small grants for families with
Okay.
that have dementia in their family, and that can help pay for anything. It could help pay for home care. It could be medications, equipment, and then there are other networking groups that I belong to that I think helps. educate people about who we are,
Hmm.
and educate me about who they are and what they can do to help us.
Right. Now, so you just brought up the grant. So is this something that insurance would help cover or not?
No, the home care is we do take, and we have a number of clients that are VA veterans,
Okay.
and we do take VA benefits. What and I will usually help families. A lot of them are already sort of hooked up with the VA,
Hmm.
and it's a matter of getting authorization from them, and then we bill the VA directly, and the VA pays us, so the family doesn't have to worry about that. Long-term care insurance is another area that a number of people have, but a lot of people don't.
Hmm.
But that is something. Unfortunately, I could get up on my soapbox about it, but
Right.
Medicare and insurances don't cover home care at this point.
Right.
Um, the Home Instead, from a corporate standpoint, has been lobbying in Washington for years. We've been collecting data to show how home care is actually saving Medicare money
Hmm.
by, you know, uh, not rehospitalization is one of the highest costs for Medicare. And, we're helping people to stay out of the hospital and out of rehabs.
Yep.
So, but anyway, we could do a whole nother half hour about that.
Oh, yeah, absolutely. I agree. Now, Tony, you brought up Alzheimer's and dementia. Most of your caregivers dementia certified or have some kind of training in that?
Yeah, we actually, I would say probably close to 60% of our clients have some form of dementia, some early stages, some,
Hmm.
moderate to late stage. So about a year ago, we decided to make sure that everybody, all our caregivers, are certified, and we have put them through the Alzheimer's um, certification program,
Hmm.
where they have to take courses and a test. And I can tell you from my own experience, the test is not easy.
Yeah.
You have to get, I think, 91% to pass. It's not like getting a 70 or 75 and you pass. You don't.
Oh, so that's
So
good. Yeah, because I
yeah,
think
it
that,
is good.
yeah,
Yeah,
because I think the signs are probably, hard to notice,
yeah,
especially in the beginning
yeah.
stages.
And
Um,
I think one of the other things that you mentioned is setting, what sets us apart. I think
mhm.
things that I notice in talking with other people is responsiveness. I think we our phones are covered 24/7. We have an on-call person who's an employee who's also a caregiver who's been with the
Oh, good.
company 21 years. Um, so phones are covered all the time.
Hmm.
Um, when I get a lot of feedback and about how fast we call back, how fast I call back, because a lot of times it is a crisis situation and you just never know. So we're
Right.
extremely responsive. Consistency, I think, is really important with the caregivers, and we really work hard to make sure we have consistency within the caregiving portion, and then reliability. I talk to a lot of people where people don't show up. Um,
Mm.
they, it's a different caregiver every single time. So those things we actually just put in place a guarantee that if we miss a shift, which we don't, that's why we feel confident about the guarantee,
Hmm.
is that if for some reason we miss a shift, we will credit a free shift, the next shift. But we don't miss shifts. We have on-call caregivers, so if somebody calls in at the last minute and isn't feeling well, somebody else is there to take their place.
Oh, so that's great. And then
Yep.
I know you're very excited about your new program that you
Yeah.
have, your senior day program. So
Yeah.
why don't we talk about that and let folks know about what that's all about?
Sure. Sure. So we are very excited about it. We, our building actually is an old Victorian house,
Mm.
and it's the home care has been up on the second and third floor for a number of years, and the first floor became available. And so we decided, we'd sort of talked about this for a while, but we decided to start a adult day or senior day program, which is a dementia-friendly program for families who are dealing with dementia. Um, and so it's a social model. There are a number of adult day programs that are more medical models. Ours is really social. Everything that we do in the home, we do here. But it's I think, a very homey atmosphere, and sort of small, and we won't
Hmm.
have more than 8 people at a time.
Okay.
Each day. And, from a cost standpoint, it's, a little bit less than what home care would
Hmm.
be. For a full day, it would be considerably less. We do both full day, which is, an 8-hour day, or a half day, either in the morning or in the afternoon.
Okay.
And we've got all sorts of activities and food, and um, you know, Father's Day, Mother's Day, all the holidays we celebrate, St. Patrick's Day. Um, w- the people we have coming are just, I think, having a blast, and we're having a great time with them as well.
Oh, that's nice. Well, I can
Yeah,
speak to the space because I was fortunate enough to see it, and it is
yeah,
it's lovely. It's very, like you said, it feels like you're at home.
yeah,
So it's a
yeah,
nice living room space. So I love it. And
yeah.
then, do you offer transportation to that, or are they responsible for their own transportation?
Currently, they're responsible for transportation. We're looking into a van, but I think that, um, you know, right now, I mean, I'm talking with some of the other adult day programs.
Hmm.
Actually, finding drivers for
Right.
the vans has been really difficult and challenging.
Hmm.
Um, I mean, we do have a built-in staff,
Right.
so it's something that I'm sure in the future we'll probably do. I think starting out, we wanted to just sort of see what the need was for that. But we do get people out, because we have a couple SUVs, and so we'll take them down to Situate Light to walk around, or go get an ice cream, or something
Oh,
like that.
okay.
So yeah,
That's nice. Now
yeah.
tell me, is there any before we wrap up, is there anything else that because I think this has been a great overview, but anything else that we haven't touched upon that you would like to touch upon?
No, I think it's been great having the opportunity here to speak with you, and have met you in the past, which has been great. I think that, the way our tagline is, to us, it's personal.
Hmm.
Um, and it really is. I mean, the team here in the office, we really look at this. It's a really interesting um, business model, because it is a business. But we get really involved and attached to our clients, and even the people who don't become clients. I'm still in touch with a family member who, was out of our territory, but we became friendly, and we're still. His wife is now in a memory care community, and so I guess the point being is that, everyone in the office, um, just really feels that it is personal, and we take this job very, very personally. Todd and I, not too long ago, went over to Etrusco in Situate, which is a great place
Hmm.
for equipment for free. And a client needed a hospital bed, so Todd and I uh, went down there, picked up the hospital bed, took it over to the client's house, set it up, get her comfortable, get the family all comfortable with the fact that it was there, and we didn't charge her for that. It's just sort of the right thing to do, and I
Hmm.
think that sort of permeates the uh, the culture of our business. And I think, lastly, the caregivers are just a special breed of people.
Hmm.
We've got an incredible team. I think we keep our people because we take care of them. We have, um, an 800 number set up for them. So if there are any mental health issues or bereavement issues, it can be totally anonymous. We have therapists that will work with them. Cookouts, they get um, quarterly bonuses. They're really part of, we're just sort of a big family.
Yeah.
So
No, I
anyway,
think, yeah, well, no, I think that's important. I mean, you're caring for people's, parents and
yeah,
loved ones, for the most part, right? So of course it has to be personal. So, and I
yeah,
know what a warm and friendly heart that you have. So, I think it's, a wonderful service that you're providing there.
great,
So,
great.
um, tell me, what's the best way for people to get in touch with you, Jay, so that they could set a consultation up?
I think if they just lean out their window and yell Jay Tolman, no. Actually, you could call the office, which
Hmm.
is 781 You could email me, which is jay.tolman, Tolman, @homeinstead.com. Or you could go to our website, which is homeinstead.com/475. So any of those ways, or you can just Google us, Homestead Norwell.
Okay.
So, yeah,
Great. Well, I
great.
really appreciate your time today and being with us.
Yeah,
And
thanks, Karen.
yeah, thank you. And I hope that some people reach out to you because, again, I think it's a wonderful service that
Yeah,
you're providing there. And hopefully people come and even check out, maybe do a tour as well so they can check out the
yeah,
day program.
absolutely. That'd be great. That'd be
Yeah. All
great.
right. Well, thank you
All
again.
right. Yep. Thanks. Take care.